All right, hello everyone and welcome. Dr. Rich Castellano here, double board certified facial plastic and reconstructive surgeon. We're here with Linda today. Thank you so much, Linda, for coming in. We're doing some Sculptra and I'm going to zoom in. Here are her pictures. Linda looks great. She's done a lift in the past. If you look under the eyes, we're just trying to treat in the cheeks a little bit, give her a little bit of volume back. So I'll show that we're on Facebook, Periscope, and YouTube. And Linda had a wonderful spot on daytime. Thank you so much for coming out and joining us there, Linda. And so we've already done a little cleanse on her face. What I'm going to do is I'm going to zoom in so that way you can see how we do the injection technique. There we go. Perfect. And let's see if that light will. It's a little bit dark in here. Can you open up the blinds for me, please, Elise? Hello, hello. Welcome. Thanks for joining in. For those of you just joining, I'm Dr. Rich Castellano. Someone asked, how long does it last? Thank you very much. And Sculptra can last about 2 to 4 years. It takes 3 weeks to 2 months to see the result. Even up to 6 months, Sculptra can have continued improvement. It is a collagen stimulator. It's a great filler. We've used so much of it. And once you do fillers long enough, everybody asks, don't you have something that lasts longer? And we do. That's the Sculptra. Hello, thanks for joining in. All right, so we did a little bit of the cleanse. So I like to do the numbing medicine, and I use this buzzer. So this little buzzer is a vibration device. The brain can only focus on so many things at one time. So I'm going to have you rest your head all the way back for me, Linda. So we do a little buzz on the cheek, and you feel pinch on 3. 1, 2, 3, pinch. And Elise already did our HIBA cleanse over the skin. I like to do that cleanse on the skin. We're going to do some in the smile lines here as well. 1, 2, 3, pinch. Always fast, but never hurry. Little pinch. So I numb the areas where we're going to make the insertion point. And I want to do just a little bit in the brow. 1, 2, 3, pinch. Linda has really good volume in her temples. There's not so much hollowing there. We talked about filling the volume in here. We may come back later another day and do more, but let's see how this first vial does. We're doing 1 vial of the Sculptra. I like to dilute it up into about 7 different syringes. So a little buzz and pinch here. 1, 2, 3, pinch. You doing okay, Linda?
I am.
Linda's tough. 1, 2, 3, pinch. 1, 2, 3, pinch. And we'll pinch here. 1, 2, 3, pinch. So when we look at the anatomy too, we tend to get the little hollows and dark spots in this area, and it follows out in this area as well. This area we call, it's a bit of a festoon. Doesn't really show up too much in Linda, but it's sun damage to the skin and changes in elasticity. Those areas are more prone to swelling. They respond best to laser treatment, and so fillers can help some, but if a patient wants more improvement in the festoon than what the fillers can achieve, then we recommend laser treatment for that. So this is a 25 gauge. This is a 23? 25. This is a 25 gauge. You only have 25 gauge orange hub, and this is what we use to make the little insertion point. Now, do you feel a little bit of a pinch here, little pinch, or not too bad?
No.
So that's the insertion point. That allows me to place the cannula through. The cannula is a blunt tip needle, which is less trauma, less bruising. So we just make that little insertion point. Now this is a 27 gauge cannula. It's soft tip, 2 inches, and so I know I don't necessarily want to see that, but I'm doing my little teaching here. So we'll thread right through here, and that gives me a little more. So I like to use my little twist technique. You feel a pinch there?
A little bit, not much.
And then I like to use my little shiver technique to just shiver. The shiver allows you an even distribution of the product in the tissues, and it's harder to get the filler into a blood vessel when you're shivering the needle around. It's hard to get a needle into a blood vessel at all, but if you're shivering and moving, it's hard to get in or stay in because you don't want to inject the product inside of a blood vessel. It's not good, so don't do that. And the cannula makes it very, very difficult to have that introduction to a blood vessel, but also knowing the anatomy and having good experience and good injector and low injection pressures. With the Sculptra, since it's a very watery based injection, it's very easy to inject. It's very, very low resistance, low viscosity. They like to use the fancy words G prime. So It's very kind of a watery. And I'll inject and I'll do some massage around here. Hello, thank you for joining in. You can use Sculptra all around the face. You can use it all around the body. Thank you, Michael, for asking. People are using it to enhance their bottoms. They're using it in the neck for crepey skin. So neck, knees, elbows, anywhere that you want to thicken the skin and build collagen, Sculptra does a good job. Linda, how are you doing, dear?
I'm good.
She's tough. We try and make it easier than the dentist's office. So I did one little syringe there. So I break it all into a vial. Some people will do 10 or 15 syringes for the injection. You can mix it up and it's still the same amount of one vial, but it just depends on how much you dilute it. Hello to Walter. Hi, Amy. Thank you for joining in. So you feel a little bit of a pinch there?
No.
So I'm going to do the same thing on this side. All right, and please do follow us on Facebook, facebook.com/ImageLift. We'll be broadcasting there as well. So, for those of you just joining in, this is the Sculptra. And you can see it's kind of looks like a little bit cloudy. And so we just insert that little area here. And Elise has set everything up perfectly for me. Thank you so much, Elise. I could not do it without my team. I truly am so proud of my team. I mean, they really take such great care of me and our patients, and the preparation and the care that they have for our patients is amazing. So no one is an island unto themselves. Linda, how are you doing, dear?
I'm good.
So Linda has had a lift done. We did a little touch-up procedure recently for her. She does not look her age. We're so excited for Linda. She's got a new relationship in her life, and she deserves nothing but the best. And then you can show that. Here's a little vial of the Sculptra that you can see. There you go. Thank you, Elise. Hello, Freja. Thank you for joining. Check us out on YouTube. Check us out on Periscope, check us out on Facebook. So as you can see, these are gradual changes. You must look natural, okay? If it doesn't look natural, it doesn't look good. Linda will pass the grocery store test today. If she walks into the grocery, nobody really does a double take, okay? And that's good, that's what you want. The best cosmetic treatments are the ones that people can't see, they can't figure it out. So I want to try and build the oral commissure. We lose bone, we get the crease in through here, and a little pinch through there. And that just makes the insertion point into the skin. Most patients, you're going to have little or no bruising with a treatment like this. Thank you, that's perfect. So I thread the little port entry point. I'm going to turn your head to the side. Thank you, Linda. We feel a little pressure, pinch. The twist technique is important. It's the least traumatic way to insert the cannula, in my experience. You twist, you shiver, you move around. It allows that cannula to thread through the tissues without disrupting and tearing the collagen, tearing little tiny blood vessels, causing bruising. So the shiver technique is a very powerful way to do the fillers. I'm very proud to be one of the top injectors with long-term fillers in the United States, and we do a lot of fillers here. Fillers are the future of plastic surgery. There's no downtime. They look natural when you have the right artist. And they get great results. What's not to like about that? If you can avoid surgery, coming from a surgeon, avoid surgery as best you can. If you want more results, the procedure, they're never going to replace a facelift. But if you do fillers often enough and early enough, you can push off or try to prevent needing a surgery. So they are the future of plastic surgery. And if we're lucky, aging keeps coming for us, you know. Not easy being human. Yes, this was her choice to do that. Hello, Melanie. Thanks for joining in. Now I'm going to do a little bit in the brow. I really like doing the brow because we lose volume. So thank you for keeping your comments nice. People talk about, is this vanity when we do cosmetic procedures? And when we use our appearance can be used positively or negatively. Some people use their appearance to put down other people negatively or put down themselves. That's vanity, a little pressure pinch. But when we use our appearance positively to inspire other people or inspire ourselves, that's called style. And there's a big difference between vanity and style. If you think this is just for vanity, you should not do it. You should not do things for vanity. You shouldn't use vanity. But when you use it for style, when you're using it for yourself or to help other people, we live in a world where you can make choices and you don't have to do what other people tell you what to do. You have freedom. And so that's why we've got freedom of style. We're very proud. Linda has great style. Nobody guesses her age. She's got many active years ahead of her. She's raised a family, and now it's her time, so we're very honored and grateful to be a part of her life and help her in her goals of looking and feeling her best. So thank you for your comments. Thank you for your questions. We are in Tampa, Florida, and in the Villages, Florida. Look us up at ImageLift.com. We have 2 Wall Street Journal best-selling books. Look us up on Amazon. And so I like to do this massage, 5-minute massage, 5 times a day for 5 days. We get a little bit of a hollow through here, so I just want to build that up some. It gives the appearance of lifting the brow a little bit. I think that's definitely a better strategy and solution than surgical brow lifting. And patients agree. It was a tough moment when I realized as a surgeon, I spent all that time training and becoming a surgeon, and then I realized, what, you mean people don't want surgery? I certainly don't want to have surgery if I don't have to. So why would other people? But if they need it or want it, I can certainly do that. But my first job is, how do I prevent surgery? How do I give people the best results with the least intervention? Hello, Amy. Thanks for joining in. Please do share. Let your friends know that you are watching live procedures, live filler treatments. We're proud to be a top injector. I do a couple hundred syringes of filler almost every month, and you get the hang of it after you do a few thousand. Pressure pinch, pressure pinch, pressure pinch. So I'm just elevating the brow a little bit here. We lose volume in the brow. I like my little shiver technique so I can inject small amounts as atraumatically as possible. Looking good. Hello, Lee. Thanks for joining in. Thank you for keeping your comments nice. Appreciate that. Everyone has a little bit of different opinion, but we are expressing our own personal style. And Linda had a really nice spot. She came on Daytime and shared her experience and has inspired many people. Thank you. Thank you for your comments. Oh, I appreciate that. Thank you, Amy. And once again, thank you to my amazing team, Elise, Nina, Charlene. I couldn't do it without them. Thomas and Ginger, Euphemia. We've got Violet now, Mindy and Stephanie, and of course Jen. We had a great event the other day, which we also posted on video. Linda, do you feel much pain there, dear?
No, it doesn't hurt at all.
Someone made a comment. They said, it looks like that hurts. But she says it doesn't hurt. I believe Linda when she says
It was numbed.
Yeah, I did do some numbing, right? I did some numbing. But you can see she's not jumping out of the chair. We try and keep it easier than the dentist's office, and we try and also keep it easier than getting a tattoo. So,
No tattoos.
so I'm going to do a little bit more in the cheek here. So this is the Sculptra. That's right, she is just amplifying her favorite part. So that's the Sculptra. And I'm going to build a little bit more into the cheek. So I'm going deep, I'm going superficial to the bone. There's a fancy name for that. We call it supraperiosteal. Doctors always have to have some fancy names for everything we do. It makes us feel important, you know. I like to feel important. And so, little microscopic, I'm just putting another 1/10 of a cc. Now, the Sculptra can settle a little bit, so what I'll do sometimes is I'll just put a little bubble in there to mix it. Is there a way to get rid of the lower eyelid bags and without surgery? Yes, fillers. Someone said about finding happiness and learning to love yourself. Absolutely. Love yourself as much as you can. I love to love myself. And if you want to invest in yourself, whether it's your hairstyle, your clothes, or whatever you do, your activities, the people you spend time with, or whether you're putting on makeup or you're doing little facial fillers, There are people, usually the younger people are, they sympathize less with cosmetic procedures because they have not experienced a lot of aging changes to their face. But the reality of the world is people treat us differently based on our appearances. Oh yes, I certainly would say this is more invasive than a haircut. I would agree with you on that. And so because people treat us differently based on our appearance, it's okay to take advantage of your style. Your style is what you say to other people before before you talk to them. So your style is very important. Hello Derek, good to see you. Hope you're doing well out in Indy. Tell everyone we say hi. So I like to do that massage. I'm doing a little bit more in the cheek. Linda, how are you doing, dear?
I'm good.
Very good. So we've got just a little bit left to go. Always fast, but never hurry. Someone said they need a trip to Tampa.
Come on down.
Oh, the weather's beautiful. So you can see fillers are very simple. In fact, a lot of people are doing fillers. But you want to make sure whoever's doing fillers for you is an expert. And as a surgeon, I like to offer my patients fillers with my experience sculpting, surgical anatomy, all of those things matter for your results. Very good. And we like to give patients choice. Some patients choose short-term fillers, some choose longer-term fillers. There's 3 questions you have to answer about fillers. Number 1 is where you want the filler. Number 2 is which filler. Number 3, how much of that filler. Someone said about liposuction, smart lipo. You can email me at rcastellano or message me, R as in Rich, rcastellano at ImageLift.com, and I can give you referral information. I'm going to do just a little bit more in through here. We're going to wrap things up. Thank you. I'm going to build a little bit of the jawline. Yes, it does make someone look younger instantly. Why would someone choose a short-term filler? Some of the short-term fillers are really good for superficial wrinkles and for the lips. And some people just want to get a feel for it. They want to convince themselves that they're going to look natural. So that's a good option. Short-term fillers can be the right now filler, but the most expensive filler is the temporary. You have to keep replacing it. So longer-term fillers do a much better job. They're better value. And Sculptra is unique in that it builds collagen as a collagen stimulator better than most other injectables.
Somebody asked why I didn't do long-term.
This is a long-term filler. It's a 2 to 4 year filler. And so, what was it about the Sculptra that you liked the most, Linda, that made you decide?
Since it's my first filler ever, I just wanted to see how I liked it before I went to a permanent.
Yeah. I mean,
filler.
Sculptra is a great filler. I've used it on myself, and it's really about patients knowing their options. When patients know their options, they can choose what's right for them. I mean, we live in a world of choices. Look at all the amazingly different choices people are making in today's world. So give people the choice. They'll choose what's good for them. It's
Yes.
very artistic. Can you do filler in the neck? Yes, you can. They said, did that hurt?
Not at
too-
all.
They're
No.
asking, does that hurt, Linda?
Mm-mm. I felt it, but it didn't hurt.
Okay. Hello, Julie. Thanks for joining in. Everything's looking at this last little bit, and then we're done. We'll get some ice for Linda. So I recommend that 5-minute massage, 5 times a day for 5 days. We're very proud of Linda. She is an inspiration to many people. She's a family woman. And what do I always say? When we raise a family, who gets put first?
The kids.
The kids and everybody else. And who gets put last? The parents, mom and dad. And so this is a wonderful opportunity that we can put moms first. We can put Linda first. It's her time. Some people spend their time, they want to go fishing, they want to go travel, they want to golf, they want to, whatever they want to do. And if you want to enhance your appearance, well, we're honored to be a part of that. So we're completely done. That's 1 vial. That's right, she's taking care of herself. That's one vial of the Sculptra, and she looks natural. So, Linda, can you see how it fills those areas in?
Mm-hmm.
Okay, we got a little blood drop there. We can't send her out with the blood on the face. It doesn't look good. Okay, so make a big smile for me, big smile. Now relax as best you can. So I want you to do that 5-minute massage, 5 times a day for 5 days. You can pinch, pull, push, circles, up, down, and then across the brow. I want you to massage. Now normally I do a 1 or 2 month follow-up, and so now you can see Linda where she is right now, and she looked great before. It was just a little minor enhancement here. Here was her starting pictures, and you can see a little bit in the contour there. Now there's more shadows in here. Hello, Maharshwari. Thank you for joining. So these are her before pictures, and show them one more time. Make a big smile and see how good she looks. So congratulations. Thank you everyone for watching. We'll have more videos soon, so please do follow. Oh, they said they asked if Linda could adopt them. They're so sweet. All right. Thank you all for watching. We'll see you soon. Bye. Great job, Linda. Thank you, Elise.
Uh-huh.